As a doctor faced this difficult decision, I would first consider the ethical principles that guide medical practice. The principle of beneficence, which emphasizes doing good for the patient, would suggest prioritizing the critically ill patient who needs the medication to survive. However, the principle of justice, which focuses on fairness and equality in healthcare distribution, would argue for giving the medication to patient with a better chance of survival. In this situation, I would also consider the concept of triage, which involves making decisions based on minimizing overall benefit and saving as many lives as possible. In this case, it may be more beneficial to give the medication to the patient who has a better chance of survival in order to save more lives in the long run. Ultimately, this decision would be incredibly challenging and emotionally taxing. It is important to seek guidance from colleges, sticks, committees, and other healthcare professionals to ensure that the decision is made in a fair and ethical manner. It is also crucial to communicate openly and honestly. Communication with patients and their families is also key in navigating this challenging situation. It is important to be transparent about the decision-making process and ensure that everyone involved understands the reasoning behind prioritizing certain patients over others. Compassion, empathy, and clear communication are essential in maintaining trust, understanding during times of medical crisis. This decision prioritizes the patient with a better chance of survival, respecting autonomy and dignity while minimizing benefits. Continuous evaluation and improvement are necessary to address similar dilemmas. There are a few reasons I might prefer to help those who have a better chance of survival than those who are critically ill. One reason could be that helping those with a better chance of survival may feel more rewarding as there is a greater likelihood like the person will recover and thrive. Additionally, I may feel that my efforts are more likely to make a difference in the long term if I focus on the individuals who have a higher chance of survival. Finally, it may simply be easier or less emotionally taxing to help those who are not in critical condition, as caring for someone who is critically ill can be extremely challenging and draining. Ultimately, the decision of who to help is a personal one and may depend on individual values, beliefs, and capabilities.